Hi class, this is Carolyn. I'll be discussing narcissistic personality disorder. So the diagnostic criteria states that an individual must have 5 or more of the following: a grandiose sense of self-importance, be preoccupied with fantasies, believe that he or she is special, require excessive admiration, have a sense of entitlement, take advantage of others to reach their own goals, be lacking in empathy, be envious of others or believe that others are envious of them, show arrogance, haughty behavior, or attitudes. Some of the challenges when treating these clients include they like to take charge of the conversation. They are self-aggrandizing, meaning they will have a one-way conversation about their, last investment or their special one-of-a-kind collection of this or that. And they tend to detach from any emotional subject that a counselor might talk about, maybe because they are in denial or lack of awareness, and they tend to project blame of their problems onto others. Some of the therapeutic interventions include psychodynamic therapy, CBT, group therapy, and family therapy. Obviously, the psychodynamic therapy and the CBT therapy would be the more productive forms of therapy, whereas the group therapy might have some benefits, but probably wouldn't be the most effective because they will all try to take over and dominate each other or one-up each other. The differential diagnosis for this, I put up all 4 of them, but the biggest one is the other personality disorders that's on there. And the DSM-5 states there are 2 situations for this other specified personality disorder. And that's when the pattern meets the criteria for a personality disorder and traits of several different personality disorders are present, but the criteria for any specific personality disorder isn't met. The other situation is when the DSM-5 hasn't included the classification for that personality disorder. An example of that would be a passive-aggressive personality disorder. I'll also be discussing the histrionic personality disorder, and the criteria states that the individual must have 5 or more of the following, and that is to be uncomfortable in situations where they are not the center of attention, that their interactions tend to be sexually seductive or provocative in an inappropriate manner. They display rapidly shifting and shallow expressions of emotion. They are consistently using physical appearance to draw attention to self. They have a style of speech that is expressively impressionistic and lacking in detail. They show self-dramatization in being dramatic and exaggerated. They are easily influenced by others. They have a grandiose sense of self-importance, and they consider relationships to be more intimate than they actually are. Some of the challenges in treating these clients include they tend to put the counselor in a rescuer role, always asking for reassurances. Another problem is they would tend to be seductive in the therapeutic setting towards the counselor, and then they attempt to periodically please the therapist. So the therapeutic interventions for treating these clients are psychodynamic therapy, CBT, group therapy, and family therapy. Again, the group therapy might have some benefits, but probably wouldn't be the best choice because they're going to take over and try to dominate the session as well. And that's it. So thank you guys.